Well, today we are talking about where we're currently at as a nation in terms of our overall health. We're hitting on the idea of investing in your health, the importance of, man, if we don't have the tools, we don't have the answers, what does it look like to invest into something that's going to benefit you?
Yeah. Yeah, lay out for us kind of, I mean, I think we're all like semi-aware of the fact that we're not healthy as a culture right now. I mean, especially in the United States. We're struggling, I think, worse than most countries.
Mm-hmm. Which is insane because in terms of like health spending, we surpass most every nation.
Oh, yeah.
But when you look at the data, the graphs show like we are at the bottom of the pool, like compared to like almost some third world countries in terms of our overall health as a nation. Yeah.
Yeah. I mean, for a country as like wealthy and modern as we are, and the amount of money we spend on quote unquote health care, we are an incredibly sick culture.
Yeah.
Yeah. So yeah, go ahead and lay out for us.
Sure,
I know you have some, I know you have some
this
stats
is just
to share.
Create clarity, right? We're not here to like point fingers, call people out, like
Shame.
that sort of things.
Shame.
So just sharing these statistics because I think clarity is everything, and when we can kind of grasp the full picture, it can help us see the reason, the big why, right? As to why should I pursue a better lifestyle. So this is kind of nuts, but we'll start with some obesity rates. 42% of U.S. adults are considered obese. 73 to 74% are overweight and or obese combined. So different like protocols or groupings as to if you're X amount.
It's different standards. Yeah. I think I don't know if they're basing that off of body fat percentage or if they're basing that off of BMI.
BMI.
Yeah.
Which BMI, not to go on a tangent, like we know it's in some cases it's not the best. I mean, I have a high BMI based on muscle mass.
It's because you're fat, dude.
Yeah. Well,
No, I think, okay, I see what you're saying. Yeah, we know that like BMI can be inaccurate if you have more muscle mass.
Yeah. In these cases.
Yeah, that's what I'm saying is the BMI is only really it's not like a super accurate measurement. It's a useful tool, but it's not accurate if you are in the gym lifting weights a lot and you have like above average muscle mass.
Yes.
But I don't think that that's an issue.
No.
You know, it's not like 30% of Americans have above average muscle mass. It's like that. I think that's probably fairly accurate, even though saying BMI isn't the most accurate thing all the time.
Yeah, we can't use it as a cop-out. Yeah. We have a standardized testing protocol for a reason.
Yeah.
So
you guys do not get a pass on this. 75% of us, 74% of us are
no doubt.
either overweight or
that's a massive
obese.
Massive number. Chronic disease, 60% of adults have at least one chronic disease. This is even more staggering. 40% have two or more.
Wow.
Physical activity. Only 23% of adults meet basic strength and cardio guidelines, which I think it's important to probably preface that like the strength and training guidelines of like modern America versus like maybe what we would coach people to is a little bit less. So, I think that percentage would decrease if we were to peer review what is the standard. Like, are we strength training 3 to 5 times a week? Are we doing cardiovascular training 2 to 3 times a week? Are we getting 10K steps in a you know what I mean? That I think that percentage would start to drop.
What does it say? 23%?
23%
are meeting
adults. Sorry, we did. They meet the basic strength and cardio. So what is that? 77%. Yeah, math was not my strong suit. 77. This is why we write it down.
Yeah.
77% of adults are not meeting the standard.
Standard.
Yeah.
For strength
and cardio.
Cardiovascular standards. Yeah. I wonder what those standards are. I would imagine that they're...
Well, because I think what we do as a nation is like we get a little bit unhealthier and our standards come down. Yeah. And then it's almost to try and like boost our stats a little bit.
They do that with like the education system.
Yeah, they do. Muscle loss. So sarcopenia, adults lose 3 to 8% of muscle per decade after the age of 30. So imagine like every 10 years you lost 8% of your muscle mass, like just wasting away.
And most of us didn't have that much to begin with.
Sure. Yep. But I think the big thing with that one, I mean, it says after 30 years old. So I think what it goes to show, it's like, man, we go our whole lifetime being active. Like at school, we have a built-in recess time, right? Like we're running in PE, we're playing sports, and then we hit the age of 30 and suddenly we just drop off. And it's like it's almost like we join that like 9 to 5, 40-hour a week workforce and start having kids and start getting stressed, and we just like totally fall off in terms of our activity.
Yeah.
And I think that plays a massive role because it's like if you don't use it, you lose it. So
that's crazy. The chronic disease one, I mean, the obesity, like the obesity numbers are pretty staggering.
Mm-hmm.
Like that's one of the most prevalent issues.
Yeah. And
you cannot argue that like being overweight or obese is not unhealthy.
Mm-hmm.
Like you kind of see that argument in the last few years that like, oh, you're just overweight, but it doesn't necessarily mean that you're unhealthy.
Yeah.
We know that obesity is correlated with higher cause mortality in all cases.
There's no denying it.
Yeah.
Yeah.
The chronic disease thing though is crazy. That means that like, 42% have two or more?
40% have
40%.
Yeah, 60%
have some sort of
have
like
at least one.
irritable bowel syndrome, or Crohn's disease, or
like a thyroid
issue, or like psoriasis, or like these nagging like issues, arthritis, things that destroy your joints, these things that just diminish your quality of life, and that you can't put your finger on it. You can't like go to the doctor and
the chronic disease. I would in my brain says like autoimmune type dysfunction, right?
Yeah,
it's
that's
like,
a lot of that's a lot of it.
It's
sure.
like it's a clear sign that like your body is unwell and or it's combating something that in its environment it's not happy with.
Yeah, and that's you just made a good point, like something in the environment, right? So these things like being overweight, being obese, having chronic illnesses, these aren't things you can just go show up to your like primary care physician and like get answers to. You're we can prescribe drugs to help lower your immune system for arthritis, and we can prescribe things to help with your Crohn's disease, your IBS. We can give like steroidal cream for your psoriasis, but those things are all just like covering the symptom, like trying to help you like make the symptom go away. But it's not actually like as soon as you stop doing those things, the symptoms come right back.
Yeah.
So obviously we're not treating anything that's root cause, right?
I think that's our modern day medical system. We just treat symptoms.
Exactly.
Like I was just thinking about even something like chronic pain, which we'll list out as part of this statistics. Like someone with low back pain, they're going to look for a diagnosis so that they can get to the root of the symptoms, which is going to lead them down the rabbit hole of getting injections, seeing a specialist, like in some cases, some unnecessary surgeries potentially. Like dry needling, cupping, like looking for a method that's going to treat the symptoms so that they can get pain free. But what's the root cause of the symptoms in the first place? Like, yeah.
And that's the point, I think, kind of like from a zoomed out perspective of this conversation is, okay, like the medical system has its place for sure. Like as far as dealing with, replacing joints and acute injuries, and, there's so many life-saving treatments that we have, which are really important. But when it comes to things like obesity and chronic diseases or chronic pain, which so many people are dealing with, obviously, like we just stated, the healthcare system is failing us. And that's where I think, the road opens up to, number one, taking responsibility for your own health, investing in your own health, and finding a coach or, someone who's maybe a health coach or a life coach who's like specializes in health focus, or a naturopath, or someone that you can like. Personal trainer obviously is a great one, but someone you can actually like sit down with and like dedicate some time with to like helping you kind of figure out what things in your lifestyle and what things in your environment are not contributing to your health.